everyone. Thank you so much for joining us for today's webinar, Expanding Your Toolbox with Resources from CDC Healthy Schools. We're very excited that you joined us for today's webinar because we'll be covering so many different topics, not only in the different work that we do, but to learn more about different resources for higher education teacher preparation programs, real examples of how to get there, and leaving with your most robust toolbox from CDC Healthy Schools. I have the pleasure of introducing the dynamic panel of 4 different speakers today, including myself. My name again is Jordan Buckley, and I work with the Society for Public Health Education, or SOPHE. Next, you'll be hearing from David Birch with the University of Alabama. Then you'll be hearing from Sarah Lee with the School Health Branch at the Division of Population Health with Centers for Disease Control and Prevention, or CDC. And finally, Ms. Lois Mock of Interactive Health Technologies, or IHT. You'll be hearing much more from them very soon and the different work that they do and how they can provide you more resources and opportunity for your toolbox. In partnership with today's webinar, and to learn more about how you can start with this toolbox, I'd like to share some information about SOPHE, or the Society for Public Health Education, and organizational updates about emerging school health and teacher education opportunities and resources available at SOPHE. The Society has a long, rich history since its founding in 1950. Members of SOPHE span the globe both in the United States and around the world, with 4,000 national, international, and chapter members working in various public and private organizations. The Society provides leadership through a code of ethics, standards for our profession, research, professional development, and outreach to the public. As health education specialists, the membership is committed to advancing health education theory and research, developing disease prevention and health promotion programs, and promoting public policies conducive to health. To learn more about SOPHE, visit www.sophe.org. There are more opportunities available through community health programs and other opportunities on the ground, including school health, which I know you'll be really more excited to hear about, including opportunities for teacher education and pre-service opportunities, which I promise I will get into. These focus areas may be including, as under the umbrella of grants and federal support, unintentional injury, smoking cessation and reduction in pregnancy, chronic disease prevention, and clinical community linkages, and most recently, prevention research centers, REACH, and school health, some of the many different opportunities that SOPHE has been involved with and continue to be involved with nationally and globally in our different funding opportunities. This brings me into some of the information that you'll be hearing throughout the different CDC school health tools, including the WISC model that may be influencing how you might bring this into your toolbox. First off, with the school health project, something that SOPHE is currently working in, there is a strong emphasis in not only the whole school, whole community, whole child model and social emotional learning, which you'll see as right here, the different 10 components that you can read here in this bulleted list as part of much of the work that we're doing, as well as social emotional learning that we continue to emphasize. WISC is a model that provides a strong, unified, and collaborative approach to learning and health. Through a student-centered model, students should be both recipients of services to ensure that they become healthy, safe, engaged, supported, and challenged, and recognized as full partners in the implementation of WISC. Social emotional learning A model that is accepted by CASEL is a public health and education agency accepted model, a process through which children and adults understand and manage emotions, set and achieve positive goals, feel and show empathy for each other, establish and maintain positive relationships, and make responsible decisions, and more. This, among many different work, is how SOPHE is continuing to work in this field, and how you will next hear how a SOPHE member, Mr. David Birch, has worked with different advocacy and advisory groups to influence the work that we're doing and resources to influence teacher education programs. To that end, I'll hand it off to David to explain how he has influenced the work that he's doing with his students.
Okay. Well, welcome again, everyone. I'm pleased to be part of today's webinar. And what I'm going to do is I'm going to present some general thoughts and examples of using HEATCAT in regard to quality school health education and how it can be used in health education, teacher education, and also professional preparation for community or public health educators. Later in the webinar, there will be a specific presentation on a sequential use of actually a PECAT, which is the Physical Education Curriculum Analysis Tool. So while with HEATCAT, while the focus is primarily on preparing school health education students with course content and learning activities to be used in classes, as I mentioned before, I think it's also important for us to help community and public health educators be aware of HEATCAT. As you've probably heard the expression that school health education is public health, and so we need to have public health educators with an awareness and public health educators who are partners with school health educators in promoting school health education. So obviously how you're able to get into this depends upon the class time that you have. And so one of the things that I think needs to be considered is what courses can the use of HEATCAT in regard to school health education be implemented. It may be in methods courses, it may be in planning courses or curriculum development courses, or it could even possibly be in a Foundations of School Health Education course. But regardless of what course it is, if we think about our students, if we think about where we want them to be when they graduate, if we think about where we want school health education people to be, if we envision a continuum, and at one end of the continuum is a very basic knowledge, which could be described as, I know CDC has tools that can be used to assess curricula. So that's very introductory knowledge. But what we want to do is to get our students and grads and others to the point where they can be able to state that CDC has tools based on national standards and characteristics that enable curriculum team members to analyze important components of a health education curriculum. And then here's the key part about the experiences we should provide. Based on my course experiences, these are easy to use and provide important information for curriculum decision making. And so that's where we want to get our students, where they're more than just aware of this, but they have a confidence level in being able to use this. And so one of the starting points for a faculty member in getting ready to implement activities with students is, of course, to be familiar with HEATCAT themselves. And included in HEATCAT is a guide for health education teacher preparation programs in institutions of higher education. And this provides content via some slides and some instructional activities. So I think this is a beginning step in preparation. However, I think that there are some other things that that could be done and some other things that could be considered. So one of the things that I do relative to school health education is I start any course or any section of a course by having students rank their high school health education experience and their elementary health education experience. I ask them to give it a grade, and unfortunately, often those grades are not really that good. I ask them to give it a grade, and then we discuss it. The students first discuss their experiences in small groups, then we discuss it with the whole class. And the reason that I think this is important is that even our students who are in the major, their perception is based on the experiences that they had in school health education. And so we know that this not only, because of our lack of a sterling history, in fact, some may describe it as a dismal history in school health education, this history not only hurts us with school decision makers and stakeholders who are not aware of what quality school health education is, but it can also put our students in a position of not being able to understand what quality school health education is. So with that, what I then do after we've had this discussion is I then introduce these students to the characteristics of effective school health education programs and the national standards. And so the students look at this, and they look, and I usually guide them by giving them questions to frame a discussion, questions such as what is new, do you see anything that should be included, that's not included, anything missing, how does this again relate to what you had in school health education? And we do this individually. Students look at it and they discuss in small groups. Then we discuss as an entire class, and at the end of the class, these students then write a reflection paper on that activity. So what are some of the kinds of things that we do? One of the things that I do, and this goes beyond what's presented in HEATCAT, because I think there are things that can be addressed there. But one of the things that we do are what I call card sort activities. And so what I do is, using cards, index cards or cards about that size, I put all of the standards and all the characteristics of effective school health education curricula on a card. Then I also put examples of those characteristics or the standards in practice. I also put health topics, and I put those in a set of cards, and I usually will have 5 or 6 sets per classroom, and the students will organize those cards in whatever way they see appropriate. And so there's no right or wrong way to organize them. And so this helps sort of get the students engaged with the characteristics and engaged with the standards. And it also helps them not only learn from the instructor, but learn from each other. So that's one activity that I do. I also then think something that's important once they have a beginning understanding of the characteristics and the standards is to think about the teachers who are going to be implementing the standards. And so what do they see as characteristics that are important to those teachers? And so I ask the students brainstorm what they think are important characteristics, and then I provide them with sort of a backup list. And we talk about things such as passion, professional preparation, being reflective, being culturally competent, being committed to professional growth, having expectations for students. And so this way, I think the students have an overview of what teachers need to have, or what characteristics teachers should possess as they move forward. Now, specific to HEATCAT, there are a number of activities that can be done with in reviewing the HEATCAT document itself. But as I said, I think some of that preliminary information that I just went over is important and informs students to be able to then use HEATCAT and to be able to review HEATCAT. So obviously reviewing the document is one way of doing this. Another way is that you can develop hypothetical implementation of health education, and students can review that and use a section of HEATCAT to review the hypothetical simulations. Now, obviously, what would be a little more authentic would be if students can actually review a curriculum or review a component of a curriculum using part of HEATCAT. Then also, too, I think that HEATCAT has a really important question and answer section that can be helpful to students. So finally, what I want to close with is just authentic assessment of students. So assessing students in a way that's close to real-life use of HEATCAT and real-life planning and implementation related to quality school health education as possible. And so let me just put on the screen just some of the things I just went over. But a few things, scenarios that present characteristics and standards-based being addressed. So you just, as I mentioned before, not only can you use that to practice HEATCAT implementation and use of HEATCAT, but also you can use that to assess students' ability to use HEATCAT. You can even have students develop scenarios, and they can identify within those scenarios characteristics and standards being addressed. And then also, too, I will sometimes have students, even though we reviewed them, develop a Q&A on both, not only on HEATCAT, but on school health education in general, if they were presenting this to someone who was either going to implement health education, school health education, or support school health education. So those are just some general ideas, general thoughts on promoting quality school health education via the use of HEATCAT. So Sarah?
Great. Good afternoon, everyone, and thank you, David and Jordan, for kicking off this webinar. Great to see so many people joining us this afternoon. Excuse me. So David just hit on ways to incorporate one of our tools, the Health Education Curriculum Analysis tool, and another resource focus on the characteristics of effective health education. And I'm going to give an overview of three of our key tools and just give a kind of a higher level overview of each tool and what the purpose is, and then turn it over to Lois Malk, who's going to talk about how she has used one of those tools in higher ed. So I'm focusing today on the School Health Index, the Physical Education Curriculum Analysis tool, and the Health Education Curriculum Analysis tool. And hopefully many of you have heard of these tools, are familiar with them, or have even used them within your specific setting, whether it's a university or a college or a school district. So first I'll start with School Health Index. Jordan touched on the whole school, whole community, whole child model, which was released a few years ago. And because of that, we went into a new edition of School Health Index, which was published in 2017, both an elementary and then a secondary school level version of the School Health Index that aligns with all of the components of the WISC model. So at the heart of School Health Index is to enable schools to identify their strengths and weaknesses in school health policies, practices, and programs. Going through the School Health Index also helps schools develop an action plan that is really straightforward and simple based upon strengths and weaknesses that schools find when they complete the process of School Health Index. And it's a really great way to either reignite or continue to engage a school health council or team that would be and should be made up of teachers, parents, students, community members, and other school health staff. So we often have to be specific about what is the School Health Index and what is it not. So the School Health Index is a self-assessment and planning tool, and it's an educational and community organizing process. The self-assessment and planning tool piece is really meant to have this tool that is an evidence-based tool grounded in guidelines and recommendations that are built on research to walk schools through a process of assessing where they are with adoption and implementation of various school health policies, programs, and practices. It's also an awareness builder when a school health team gets together and goes through the process of examining what is really happening in their school, what is in place and what is not, and it really builds synergy across those stakeholders and gets them to, in many cases, have eye-opening experiences about what actually is going on at that school level. The School Health Index is not a research or evaluation tool, so we do not recommend it being used to create report cards or be an evaluation of specific programs. It's really meant to be able to look at where a school is and where improvement needs to be. Not a tool to audit or punish staff either. While the School Health Index is long and it can be somewhat of an intense process, it is also meant to be a very thorough and comprehensive process that includes ways that schools can have low-cost or no-cost changes made based on their results. We believe it's very focused on the best science, and it's built on also practice-based evidence, and it truly is a user-friendly experience. It's not a painful process for those of you who are on. Hopefully you did not find it to be painful. It's really, as I said, it can be eye-opening. It can be a really wonderful systemic change process for a school. And it doesn't require expensive changes as a result of completing School Health Index. So I'm not going to go through every single module, but I wanted everyone to be able to see these slides to see this is the way that the tool itself is organized in terms of the table of contents and the flow. You'll see every module within School Health Index aligns with a component of the WISC model. And these were some of these were changes that reflect the WISC model, as we've referenced a few times now, so that there are now more modules than there were before. For example, family and community used to be combined into one module, and now they are separate modules within the 2017 School Health Index. So the overall process of completing School Health Index is, one, you have to have a team. We never recommend having one person complete this. It's a much richer experience when you have a team, that team is committed, and it's made up of a diverse group of stakeholders. Having a meeting to really discuss how are we going to tackle School Health Index? What do we need to be able to do in terms of time, and what other artifacts might we need to be able to reference to be able to complete the School Health Index? Then completing the modules and the planning questions, reviewing the results, and creating an action plan. And then the last part is really that reassessment. Where are we based on results? How far have we come? And how often do we want to repeat School Health Index to keep just checking in to see where we are with our policies and practices? Okay, so that's a quick overview of School Health Index. And I'm now jumping into the Physical Education Curriculum Analysis Tool, or what we call PECAT. We're very excited to announce that we have just released the PECAT, and it is in hard copy only. If any of you were at the SHAPE America convention, we had it available there. But it will soon be up online within the next few weeks, so you are able to download a PDF copy of it as well. We released the first version of PECAT, or 1.0, in 2006, so we're really excited to have a new version in 2019 for all of you to use and be able to explore, hopefully integrate into your college or university or school district setting. So the PECAT is really meant to help districts and schools conduct a clear, straightforward, and very comprehensive analysis of written physical education curricula. One of the main reasons that we revised the tool was that there were new physical education standards that SHAPE America published a handful of years ago, moving the standards from 6 standards to 5 and developing a much more deep document to support the standards that included those grade level outcomes. So the PECAT is organized very similar to what it was previously. Brief introduction and some fairly straightforward introductions about how to complete it. There are 3 key sections. The first is preliminary review, the second is standards analysis, and the third is curriculum improvement. And we have a new section, which is in the appendices, which is how to use PECAT to help develop a curriculum. One of the things we realized with the first version of PECAT is that many districts and the schools that they serve did not actually have a full, true curriculum. They maybe had a scope and sequence. Maybe they had standards with some learning objectives, but not a comprehensive curriculum. So we hope that section is useful for all of you as you think about building curriculum. So the preliminary review section has a curriculum description worksheet, which is a very detailed worksheet that includes lots of questions that talk of everything from what is your philosophy and your vision for your overall physical education program down to specifics about the curriculum itself. What grades does it cover, how many units, how many lessons, what type of student assessments, etc. The accuracy worksheet focuses on how scientifically sound and accurate and evidence-based is our curriculum. If we haven't looked at our curriculum or tried to build a curriculum for years, is it still based on science? So it asks a series of open-ended questions for you to consider. Acceptability is very focused on whether your curriculum is culturally relevant. Does it meet the social norms of students and parents and families in your community? Feasibility really digs down into, if you have a curriculum, is it feasible to implement this within the time that you have, with the number of teachers you have, etc.? And then finally, is it affordable? Do you need a lot more equipment than you have to be able to execute the curriculum? Do you need to buy any additional pieces? Do you need more physical education teachers? So it walks through a worksheet to really calculate how much it will cost to implement. Standards analysis is really the heart of the PECAT in terms of this is where the greatest depth happens, and it really helps users determine how well the curriculum addresses each of the national standards, and the following aspects are within the standards analysis. Are grade level outcomes highlighted and included within the curriculum across all grades? Is the physical education content that is outlined that is necessary for students to know and be able to do by the end of different grade level groupings actually there within the curriculum? And are there student assessments that align with what is being taught and what students need to achieve? I know it might be kind of hard to see this, but this gives a snapshot. This is, for example, the grades 6 through 8 grouping for Standard 1. Demonstrates competency in a variety of motor skills and movement patterns, and it lists the standards with all of the subcomponents. And then for each grade level, are outcomes addressed? Is content included within units and lessons? And are there assessments to determine if students are achieving the learning objectives and the overall outcome? So that was PECAT, and then my last piece is on the HEATCAT, which obviously David has touched on in terms of how he's integrated that into his courses at the university. I'm going to give just a higher level overview about what this tool is. So very similar to the PECAT, it is meant to help districts and schools conduct consistent, comprehensive analyses of health education curricula, whether it be developed by the district, it could be commercially developed, Either way, that is the intent of HEATCAT. Sometimes it can be used to help make decisions about what to purchase, and we've known folks to do that as well for both of these curriculum tools. This tool also is focused on the National Health Education Standards, as well as the characteristics of effective health education curriculum that CDC published a few years ago. PECAT really focuses on, as I mentioned earlier, about the evidence base within our tools and resources. It uses science to improve practice. It addresses priority health risk behaviors that have been identified and health concerns for youth. It also encourages parent and community involvement in curriculum selection and respects local authority for curriculum decisions, which we know exist a lot throughout the country. When a district or school goes through the process of completing the HEATCAT, the results can be used to improve an existing curriculum, as I said, select something that is commercially packaged, or develop or revise a locally developed curriculum. This is how the HEATCAT is organized. Similar to PECAT, general instructions and introduction. There's a general curriculum information worksheet, which is similar to that curriculum description I talked about in the PECAT, overall summary forms, preliminary curriculum considerations, similar to the preliminary review of PECAT, and then curriculum fundamentals. Chapter 6 dives deep into curriculum analysis modules that are focused on each of these content or topic areas, everything from promoting alcohol and other drug-free lifestyles to safety, sexual health, violence prevention, and tobacco-free lifestyle. Just wanted to give a plug for a set of e-learning courses that we have available for free and located on our CDC Healthy Schools website. It includes all of the tools that are and resources that are listed on here, a separate e-learning course for each of those, which might be useful for you to use within your courses. And with that, I'm going to turn it over to Lois to talk about how she has implemented PECAT at the graduate level. Thank you, Lois.
Thank you, Sarah. And welcome, everyone. I'm also pleased to be a part of this webinar. I am the Director of Education for Interactive Health Technologies, but I have put this together for you as a former instructor at Minnesota State University of Moorhead, where I was able to include the PECAT in my 474 coursework for my graduate students. So welcome. We started out by deciding what goals we wanted to have for our students who completed this part of the coursework. And with that, we wanted to give our students an understanding of the development and the analysis of a curriculum. We wanted to discuss some best practices for them so that they knew when they went out to the job site what to expect in regards to best practices. We wanted to serve as an introduction to them to as an organization and administration of PE program, which we offered also at the university. And we wanted to build their vocabulary so that they would be have the advantage when they left the university in completing their tests, their final tests. That was a big area for them to know and understand. So in introducing the curriculum, we wanted to start with a strong base that had a variety of curriculums, information, and we used a book by Dr. Jackie Lund. The text was on curriculum development. So we began by showing our students what a good curriculum and the components of a good curriculum would look like in this coursework. This course was a required course by our PE majors. It was a 400 level course, and it was taught as a hybrid course, which was a huge advantage to implementing the PECAT into this course. We were able to do both online work with the students, and also we were able to meet with them personally to do some activities in class. We also included curriculum instruction. So there were two parts to the implementation of this. Part one included the development of the curriculum. We wanted them to design a unit plan. We wanted them to come up with lesson plans and assessments for their unit plan. And all of this was incorporated into their TPA, which was a required component for them to graduate. We want to also introduce how to analyze curriculum. And the reason behind this with the students was that they would have the opportunity to go out to school systems or private school systems and take a look at curriculum and understand why it was good, bad, or indifferent, and be able to have the tool of the PECAT to evaluate it and also to be able to make the changes successfully. So they would have the research that they would have from completing the PECAT and also be able to use it as a tool to present and make changes to the better. There were 5 lessons that I implemented into the PECAT. They were designed, as I said earlier, as a hybrid. So each of these 5 lessons had different components. The components were a reading requirement, a PowerPoint review, which were posted online. They had a class activity, which we completed during the hybrid portion of the class. And then they also had an assignment, which was used for checking for understanding. And then the course discussion board, which proved to be one of the most powerful parts of the coursework. I'm going to briefly just go through some of the highlights of each of the lessons. Lesson 1 was focused on vocabulary, and when they came to class, we used the game that you may all know, Catchphrase, to enforce or review the vocabulary terminology and the definitions of them. The students, this was very well received by the students. They loved this activity, and they all scored very high in assessment of this activity. For lesson 2, they were asked to actually put down or draw a picture of what they described as a physically educated student. They could use pictures and words, and they had to complete all components of what they felt was a physically educated student. So we wanted them to include emotional health and physical health as well as mental health. And then we had them color code the different areas. Blue was the color for skill-related components, orange was for knowledge, and then red for attitude and values, and then purple for any health components. In lesson 3, we wanted them to have a basic understanding of the PECAT forms, and Sarah went through these earlier for you. The accuracy, acceptability, feasibility, and affordability analysis. So in the PowerPoint, they were given the definitions of these and to gain a better understanding of them. And then they were supposed to choose any 2 of the forms to complete as their assignment. The reason we had them choose only 2 forms is because during the process of the PECAT, these 4 forms are not all required in order to complete it. You can choose which ones are most needed for your particular district in order to come up with the information that you need to support a strong and healthy curriculum. So they chose 2 of these. In lesson number 4, we went on to talk about the basic understanding of the student assessment analysis and the content analysis. As Sarah mentioned earlier, these were 2 of the most important pieces of the PECAT. And because all of this was online, students were able to complete this assignment on their own timeline. We asked them to complete both the student assessment analysis and the content analysis for all the standards. However, we have them pick just one grade level so that they chose, if they were more inclined to teach high school, middle school, or elementary, they could choose a grade level from their area of interest. And then our last lesson, which was lesson number 5, we had them go through the scoring process of putting all of their scorecards together, and then more importantly, decide on what would be an improvement plan for this curriculum. They were to discuss how they would apply the results of their PECAT analysis to improve the physical education curriculum. And then in class, we brought this to a face-to-face discussion where it was highly effective. Students were very open with what their plans would be and how they could change things. They were also very surprised at the curriculum that they decided to use and how many things that they would consider changing in it. So as a conclusion, the students felt the discussion boards were the most powerful tool, both online and in class. They brought out wonderful discussions for the students. The students were able to feel powerful enough to be able to go to a district and look at the curriculum and be able to use this tool. They felt confident in that. The application and activities that were done in class were very well received. They were a great reinforcement for the students, and the proof of that was in their assessment at the end of coursework, which was very good, very high. Students were amazed at how many poor curriculums there were. They had to bring a curriculum. I should have mentioned this earlier. They had to bring a curriculum that was written. They couldn't just have one in their head, or even if it was online, they had to print out the curriculum so that it was a hard copy of it that they were going to evaluate. And they were also surprised at how many students or districts did not have written curriculums in place. And they also, at the very end, talked about presenting to school boards and curriculum leaders, which for me as an instructor was a high point. I felt like if they could put that together, that they felt confident about what they learned and what the PECAT offers. So lots of pluses with all of that. And now I'm going to turn it over to our leaders for this webinar.
All right, so the first question is will we have access to the recording as well as the handouts? Yes, Nancy, we will make the webinar recording available, and we'll also include the handouts and the calendar invite you received initially, so you'll be able to access those.
Yeah, I can read it. That's okay.
Okay.
When will the updated PECAT be available online? So it will be available for download by mid to end of May. And what that means is you'll be able to, the whole website will be new. The new PECAT will be there to download. And then we also have all the, what we're waiting on basically is we have all of the individual worksheets being created as fillable PDFs that you can also just have separately. And all of that will be available that in May. Just go for the end of May. And then the other piece we're working on for the end of this year is the updated online version of the PECAT, which is that interactive version. You enter your scores online, it generates the score, creates your overall scorecard. That is going to be several months from now, probably late fall of this year. And then the next question is it possible to get on the list to be sent a notification when the new PECAT goes live? Yes, we'll be happy to do that. We are going to make a splash through our partner list, and I'm not sure, Bob, if you're on that or not, but I'm happy to do that. And if anyone, I think we have a limited number of hard copies of the PECAT, and could certainly, if somebody wants a copy, I think we'd be happy to do that. I can't speak to how many copies we have right now, but. So I have another question from Don about will Heat and Heat faculty be able to access the online version to show students like a mock school? Yes, you can definitely do that. We do that for trainings that we do. We'll create just a mock scenario so participants are able to see how the online version functions, so definitely. And yes, Sue, I'm happy to send you one. So I see the question about whether there are plans to update the HEATCAT. So nothing in the immediate future to update it. Certainly if the National Health Education Standards are updated, the HEATCAT would go through a similar revision process that the PECAT did. This is Sarah again. I just wanted to mention that a resource list, and I don't know what the other document is, so I might have somebody else speak to it, but there's a resource list in the handout section, and it is a document that has every, basically most of our tools for school health, and live links and a brief description of each of those tools. So we thought folks might find that useful because we only highlighted 3 of our tools today that we felt were the most relevant for this audience, but thought you might find that helpful too.
Mm-hmm. This question is, are there discussions on accessing prior year SHI data for comparison purposes for action plans?
Thanks for the question, Sue. So right now you should be able to, I think it's labeled archive. I don't know, I don't want to get that incorrect, but you should be able to pull up your, previous School Health Index results in the online version. We don't have the capacity to generate something online that would be like a side-by-side comparison of your most recent School Health Index with the one prior.
All right, it doesn't look like we have any more questions, so that would conclude today's webinar, and thank you to the presenters and to all the participants for attending today's webinar. We're glad you can join us and hope the webinar was helpful to you. Have a great day.